Assalamu alaikum, the communication day. The first scenario, Mrs. Hind, 24 years old, she had been complaining of 2 episodes of seizure during the last 6 weeks. CT brain done for her and it was normal. A diagnosis of epilepsy is confirmed by the neurology consultant. You are the senior house officer of the neurology department on call today. You have been asked to discuss the result and the diagnosis with her. Ready, Dr. Azza and Dr. Rasha?
Yes.
Okay, here you go.
Okay. Hello, my name is Dr. Mohammed. I am one of the doctors in the clinic today. May I confirm that you are Miss Hind and your age is 24?
Yes, doctor.
Okay. Miss Hind, we are here to discuss issues related to your health and address all your concerns. Is that okay with you?
Yes, doctor.
Okay. Would you like someone to attend this meeting with us, or it's okay, we can start?
No, doctor, no.
Okay. Okay, Miss Hind, can you tell me how much do you know about your health condition so far?
Yes, doctor. In the last 6 weeks, I suffer from the abnormal shaking in my hand. The doctor advised to me to do some imaging in my brain. I am here to know what the result of this image.
Okay, and what is your expectation from our meeting for today?
No, doctor, I don't have any expectation.
Okay. Okay, Miss Hind, as like you said that you had and abnormal shaking of your hand and your body and your hands, and the consultant of the unit or the neurologist made a few tests for you, and this test including a scan for your brain, and it was normal, nothing within the scan, but still the consultant, because you had this abnormal shaking movement for more than one time during a short period, less than 6 weeks. So he made a diagnosis for what's called a condition called epilepsy. Are you familiar with this term?
No, doctor.
Okay. Don't bother yourself. It's a medical term or condition in which there is this organization or disturbance
Dr.
of the
Dr. Azza, sorry for interruption. Can you make your sound clear? Sorry.
Okay. How about now?
Okay, go ahead.
Okay. So it's a condition that is in which there is a disturbance of the electrical activity of your brain that lead to the symptoms that you had. So because you had experienced more than one episode, you need to start treatment, and you need to be managed through what we call a multidisciplinary team. It's a medical term, includes management through a group of specialized doctor and specialized nurse, including the nurse doctor and specialized nurse, and also involving a social worker and occupational worker. So far, are you following me, Ms. Hind?
Yes, doctor. But doctor, you say that my image in my brain is normal. Why I have epilepsy?
Yes, just like we said, this is decision because it's made by the nerve doctor, our consultant, and because you have more than one episode in a short period of time, and this is even with the normal scan of the brain, you need to start treatment according to the protocol of treatment. So you need to take medication to avoid this attack, and because if this attack it may if occurred again, it may lead to I don't want you to be worried, but it may lead to damage or affecting your ability of movement or so, and we don't want that to occur to you. So we need to avoid this by taking proper medication and with regular follow-up. And like I said, you're going to be followed through a specialized group of doctors. And how? So, are you following me so far?
Yes, doctor, I follow you.
Okay. So, okay. So far, do you have any concept you would like to ask about?
Yes, doctor, regarding the treatment, you need to start the treatment for long life or just for a shorting period?
Okay, this is valid concern. This treatment, it should be, I can tell it will be definitely or will be for a short period because there should be a lot of assessment in the following period. So that's why I said that will be on regular follow-up. So to assess if you may continue or you may to stop. But for now, definitely you are going to start treatment and you will be continue for a while. Maybe after a period of time, there will be another assessment. But for now, you need to start medication. Um, so far, okay. Do you have any concern? May I ask you few questions?
Yes, doctor, you can ask me questions.
Okay, Mrs. Hind. Mrs. Hind, what do you do for a living?
I am taxi driver.
Okay. So I need to, sorry to tell you this, but you need to stop driving until
Why, doctor? Why you need me to stop driving?
because, like I said, this is a newly diagnosed condition, and we may afraid that you have attack of this abnormal shaking while you're driving, and this may be hazardous for you and for the surrounding around you. So you need to stop driving for now, and there will be another assessment later in the next few months if you are um, yeah, I mean there will be another assessment for validation for driving. But for now, you need to stop driving. I'm afraid to tell you this.
No, doctor, I can't stop driving because this is my work, doctor.
I know this is your work, and I know this is a tough decision to take. But like I mentioned, this is for your safety and for the safety of people surrounding you. And I also may offer to refer you to the occupational department to help you about this matter. You need to get another job, but another job except another job other than driving for this period because, like I said, it will be difficult with your condition to have to continue driving.
Doctor,
And
for
Two
how long?
minutes
For how
left.
long stop driving? For how long?
uh, uh, they will we're going to consult with our nurse doctor, okay, to and there will be another assessment, mini assessment, and then we can tell for how long. But this I can't tell you for now for how long we will be off driving. There is a lot of rules about this. Sometimes if you have more than 2 years without any attack of abnormal shaking, you may continue driving, but this need another assessment. Mr. Hind, may I ask you, do you smoke?
What? Do you what?
Do you smoke?
No.
Okay. Do you drink alcohol?
Yes, doctor.
Okay. How much? How much do you drink?
Yes, doctor. Every day.
Uh, okay. Like more than 1 cup per day or the
Yes,
amount?
doctor. Yes.
Yes. I need to tell you that you need to stop alcohol or decrease the amount of alcohol because it's one of the beginning factor for the abnormal shaking. And if you have a difficulty with drinking too much alcohol, I may offer to refer you to association clinic that to help you about this matter because this is may complicate your condition. Do you have any concern that is bothering you?
No, doctor. Thank you.
Okay, the time's up. Well done, Dr. Azza. Apart from the voice, I don't know, is it stress because first time practice or some technical issue in your mic?
I think
Please
it's
try to
both.
correct. Yeah, it's a little bit muffled. I don't know, is it
Okay.
stress because first time or maybe technical from the mic?
Yes,
Anyway, try
both.
to correct it for the next scenario,
Okay.
okay?
All right. Okay.
Okay, thank you. Let's hear Dr. Rasha comment, then I will.
Okay.
Okay.
Dr. Azza, this the first يعني first communication session. I think good. Do you did well because I have but although I have some comment. The first of
Okay.
all, you are a neurology doctor, not medical ward doctor. Uh-huh. The second, when explanation the disease, you need to talk about the symptom, complication, symptom and sign and complication. You say the symptom, but there's not said any sign and complication. This is important, like status epilepticus. Okay. The third, there's no any sympathy and empathy. Okay.
Oh,
The other, you said this the epilepsy may be affected in mobility. Epilepsy, there's no affected in any mobility. The other, you don't say the patient to inform the DVLA. And also regarding the scenario, if epilepsy is important, to ask the patient, the female, ask the patient if there's any have a partner, if patient is planning of the pregnancy, if using the patient oral contraceptive pills, because all of this affected the clinical judgment. You mean if the patient needed to the pregnancy, if patient planning of the pregnancy, you need to follow up by the women doctor. If patient uses oral contraceptive, you need to the patient use it double contraceptive because maybe unaffected with oral epileptic medication. And also if the patient, yes, and also regarding the patient safety netting, like the patient away from the swim under supervisor, patient away from the higher altitude place. All of the lifestyle modification is important in the case of epilepsy. uh, the third, you need patient to inform the DVLA. But in the general, you did well.
okay.
Yes, thank you, Dr. Rasha. Perfect comment. Really, you summarize the case from A to Z. What she should
Okay.
do, one and what she missed. Again, just for the next session, try to be focused, confident. I guess because of the stress, your sound is like this. I guess so. So please be calm. Try to get more confidence from the practice. Okay. I want to add one point important here. The explanation of the manifestation, which already explained by the patient from the background, no
Mm-hmm.
need to repeat it.
Okay.
Okay, because she knows that she had 2 episodes of seizure. So you can say the symptoms that you had earlier showed a condition according to the consultant, the nerve doctor or the nerve consultant, that you have condition called epilepsy. Have you ever heard about epilepsy? And proceed for the explanation of, as we explain exactly, it's the electrical disturbance in the brain which lead to the hyperactivity, and it will show you the shakiness of your hands. Okay, regarding the point of the introduction, you are the doctor in the neurology, you are the doctor in the medical ward. The best word to express yourself through is by saying, and this is general advice in any station, I am one of the doctors here. Whatever your position, whatever your specialty, they will accept. But if explained, if you express another position or another department, it might be against you. So the best way, I am Dr. X, one of the doctors here, to sit with you
Okay.
and to address your concern, to explain the condition, or to explain what, the procedure, whatever the task. But please don't give a position which is not yours, or don't say a department or specialty which is not yours. So the best way, I am Dr. X, one of the doctors here. Okay, this is general advice for any session, any station. Try to use to say that. It will be easy in the next sessions and in the exam. Okay, so you will not focus, oh my God, what is my specialty? I forget which department. No, I am one of the doctors here, so I am here to sit with you to explain and continue the agenda of the meeting. Otherwise, the point, the concern raised by the patient, you answer well. Regarding the driving, yes, I'm not sure. The best answer, diplomatic, and the best safe answer, if you are not sure, is to say, I am not sure now. I will refer you to the DVLA, or I will ask my senior and I will let you know later on. As we know,
Mm.
for the provoked, 6 months, for unprovoked, 1 year. This is for the group A or the own car.
I think
But
it
the
was
heavy, sorry,
2 years. I think it was 2 years for the unprovoked.
no,
I'm not sure, but
yeah,
I think
I
it
can
was
remember
2 years.
6 and 1, 6 months and 1 year for group A, for group or group one, group two, 5 years and 10 years. This is what I
Okay.
remember also. But if you are not sure, if anyone not sure, don't give a time or frame time. You
I,
can say, I will refer you to the DVLA. They are the team assigned to give you or to let you know about your license. But he should be informing DVLA. Those patients with long time banned from driving, they should inform. One of them, the epilepsy patient. Again, for your safety, for others' safety,
mm,
you should inform them. You shouldn't drive until you have free seizure for 2 years, as you mentioned. If you are not
okay.
sure, yeah, you can say after long time we will assess you and we'll let you know. This is the first concern, you answer well. The second concern, long life doctor or lifelong or medication or lifelong treatment, we will reassess you after long time as well, if you are able to stop the medication or no. Okay, so this is another
Yes.
good answer. You answer well. I'm not sure, it might be longer time, but we will reassess you later on, possibly within 2 years. If you don't have any seizure, you might stop the medication. Okay, this is according to the guidelines. But if you don't know
Yes.
about 2 years, tell him or tell her after some time or couple of months, we will reassess you from now and then. For follow up, we will let you know, is it long or you will stop soon. This is regarding the point of medication duration. As Dr. Rasha mentioned, the female and childbearing period, you have to raise the issue of pregnancy. Are you planning of pregnancy, or are you planning for pregnancy? And accordingly, don't give her or don't advise her to stop or to continue the pills. You will refer her to the woman doctor. Okay, don't,
Yes.
for me, I will not tell her, as Dr. Rasha said, you will double dose of OCP or pills in order not to have pregnancy. No, the best way
Mm.
is to refer the patient to the woman doctor,
Woman.
and she will follow with you which way is safe for you and it could give you protection. Or if you are
I
planning
think
for
she
pregnancy,
mean to use double way to contraception, not double the dose.
yeah,
Two
she
way,
says double
To
dose.
double way,
Yeah,
contraception.
yeah,
Yes,
double way.
she
two-way.
Yes.
mentioned double dose. That's why I am correcting this. But it's again not our task to say double or single. That's the female doctor or the woman doctor will let you know what method you can use. Okay, if you know the information about two ways, so to be more protected, it's okay. If you don't know, refer her to the woman doctor. The driving issue we mentioned, the safety netting is very important. Don't forget it. At the end of
Yes.
the meeting, while closing the meeting, please, if you are swimming alone, you have to have a company. If you are going inside a locked door area, please don't lock the door. If you are going in high altitude, as Dr. Rasha mentioned, don't go alone or try to avoid these things. Why? You might have this episode and it might hurt you or it might harm your life. Otherwise, in general, as a communication scenario, Dr. Azza, you did great. Okay, so you can get at least in every skill borderline or satisfactory. So you might get 15 or not less than 14. But the important point you have to remember the pregnancy, the
The
oral
necessity.
contraceptive pills, and the safety netting, plus the things you mentioned already. Devil A, as Dr. Rasha mentioned. Okay?
دكتور باسم ما أقطع
Yes.
عليك كلامك. For the DVLA, it should be informed by whom? By the patient?
Yes.
Okay. Okay.
Okay.
No.
Okay. Someone share the DVLA. Where is it? Epileptic seizure, 1 year. Group 2, 10 years. This is
Sorry, I meant 2 years for the medication. If patient
no. I'm talking about DVLA. Yes, 2 years. If free of seizure, you can stop medication,
foul,
not driving. Yes, you're right.
yes, I meant
Okay.
for medication. Yes.
Yes, I will share the post of your scenario, Dr. Rasha. Okay,
Yes.
prepare yourself. I will try to read other comments. Hello, yes, pause. Any comments? Anyone want to add comments? Yeah,
Yes,
feel free.
doctor.
Okay, go ahead.
She asked about she's driver, and
Yes,
she asked her to stop driving because
yes,
maybe this is the main her main job. So
yes.
what will be the reply to her in case she didn't convince that she will
Yeah,
stop working?
perfect question. Yes, that's why she referred her at the end. She mentioned occupational team to reallocate you. This is the best answer because she's dependent on this job, but she cannot drive. So what she can do, refer her to the occupational worker. They will reallocate her in office job. So she will not drive and in the same time she will work. This is the best and
My
safe
second
step.
question, doctor, thank you
Yeah.
for answering. My second question is that all the job I should refer to the occupational health doctor, occupational health care doctor.
No, not all jobs. The
So,
free
for
jobs,
example, which jobs I cannot
the
refer
jobs
them
with
to
the
the occupational?
sponsor, if there is job with the sponsor, you can refer her to the manager. Or the occupational, of course, then they will refer to the manager. But I mean the free job. If someone is doing working as businessman, who's responsible for his job?
No
Himself.
one. Yeah.
No one. So you cannot say I will refer you to the occupational.
Mhm.
Instead, you can give him sick leave. Sorry, not sick leave. Even you can offer social support if he will be stopped from work. But the occupational worker responsible for the provided job or sponsored jobs.
Okay. Thank you, doctor. Thank you so much.
Okay, most welcome. Any question? Any comment?
دكتور باسم لو سمحت I
Yes.
didn't
Sure.
yeah I didn't attend from the start
Mhm.
just I hear the history when she's taking the social history so is it alcohol provoke seizure for this patient
Yes.
so
If
so then I need to take more history about alcohol and the
yes, she
alcohol
should give her the
yeah
maximum
and
limit.
send the patient yeah
Yeah, she should
Uh,
ask about the units per week, not per day. This is a good question. And ask her not to have binge drinking. Okay, why? Because she might have exaggerated seizure or provoked seizure because of this binge drinking.
I already did. I asked her if she's taking is taken daily, and I didn't say unit, but I said cup. If she's
Yes,
taking more cup per day,
exactly.
and yes, So I told her this is a lot of amount. And yes, it's alcohol is one of the triggering factors.
Exactly,
يعني
yes.
will decrease the seizure threshold.
Yes, exactly. Okay.
But,
Any other
but I think the alcohol, even the small amount, can be trigger epilepsy. Yes, I am not sure. For that, needed to stop the alcohol.
Stop or reduce the amount and refer
Yeah,
her for alcoholic cessation program or something. Because it's
I will tell you,
very
Dr.
risk
Rasha.
factor, yeah.
Yeah, it's according to the limit, you have to moderate the intake. Okay, because you might have the external examiner or the British examiner. They don't like to stop alcohol totally.
Mhm.
It's from my experience. They don't like to stop alcohol by yourself totally. So they prefer to either moderate the intake or to have less intake and not to have binge drinking. But to stop it totally, they don't prefer that. Okay, so the best way is to moderate if she's a heavy drinker and not to have binge drinking. Okay,
Okay.
this is the best way how to address the alcohol in any scenario, unless it has direct harm on her condition, like liver disease, alcoholic liver disease, for example. So it's exaggerated by alcohol. In this condition, you might tell her to stop alcohol totally. You got
What
it?
I said, I told her that she should reduce the amount that she's taking, and if this was difficult for her, we can refer her to alcohol cessation clinic to help her about this matter.
It's not called alcohol cessation clinic. It's called alcohol team or specialized team.
Alcohol, yes, alcohol specialized team.
Yeah. Okay. And smoking, you have to advise or recommend to stop alcohol totally. Stop, sorry, smoking totally. Okay.
Yes, yes,
Yeah.
yes,
Okay.
and so
Thank you.
she was okay.
Someone wrote here, Doctor. I don't. I cannot read. Except in CLD. Yes. What I mean, as I mentioned, any CLD or particularly the alcoholic liver disease or cerebral syndrome as well. Okay, if the patient is, for example, ataxic, of course he cannot be drinking. He will be drunk and he will be more ataxic. Plus the symptoms of alcoholic or alcohol toxicity. But the best way is in diplomatic way to advise about alcohol to say to moderate your intake and not to have binge drinking. Why? Because most of the complication happen when the patient is binge drinking. They can taking, for example, heavy drinking in one attack, celebrating, for example, in a party, and he will drink heavily. Either he will have alcohol toxicity, or he will be hitting his head, and he will have exaggerated seizure, for example. So the best way is to moderate the intake and to avoid heavy drinker or binge drinking. Okay, Dr. Rasha, your scenario 50, Mrs. Lana Adam, 55 years old, female, and the daughter, Mrs. Ellie, 26 years old. Mrs. Lana is stage 3 CKD, chronic kidney disease, known case of autosomal dominant polycystic kidney disease, admitted with acute pyelonephritis. Mrs. Ely is aware about the condition of her mother, and she is worried about getting the disease through inheriting the condition. Please sit with Ellie, explain the disease of the mother, and address her concern. You are sitting with the daughter. She's worried about polycystic kidney disease.
Yes, but there's other scenario.
Where? No, the scenario I post the same about epilepsy, right?
Yes, there's
Or
scenario for
meningococcal,
pulmonary.
sorry. No, it's
Yeah.
wrong chair. I will delete it, sorry.
Okay.
I, I tried to share, but all of them similar, so I cannot find it. Let me share it again in the chat box. Get ready and let me know if you are ready to start.
Yes, but I want to read the scenario.
Yeah. I'm sharing it.
Okay.
Yeah, here it is. I found it. Yeah, Dr. Nusayba share alcohol rehabilitation team. If you are not aware about the name of the team, you can say the assigned or specialized, whatever the name, but don't give particular name, which is wrong name. For example, alcohol cessation clinic. There is nothing called alcohol cessation clinic, but you can say specialized team assigned for the alcohol intake or excessive alcohol intake. You can see the scenario now, Dr. Rasha, in the chat box. The team that helps people control excessive alcohol intake is
Yes.
commonly referred to as alcohol rehabilitation team. Okay. I will read the comments quickly. Alcohol will interfere with medication effectiveness. This is another issue. And ask how many units per week. Also, avoid, Dr. Aisha, avoidance, bright lights, lack of sleep, binge drinking, of course, as we mentioned. Good also about less sleep or lack of sleep will exaggerate the seizure. Dr. GH also need to involve the family to help if she develops seizure anytime. Yes, of course. That's why she invited someone at the beginning of the meeting. You can invite. Why? Because this explanation of a disease. If she said no, doctor, I don't want, so you respect the confidentiality, but you can invite and you can ask her to educate her family and friends that she has a disease called epilepsy. Whenever I'm losing my consciousness, or if you saw me fainting on the floor, please, the instructions about the disease will be given to the family member or the friends. Why? To help her to recover and to cure her from the complication of the status epilepticus, for example, until the help will come. So they will not treat, they will just cure, they will call for help. Why? Because the patient might lose the consciousness and it might affect the breathing. They have a technique how to prevent the complication of status epilepticus. They have particular position, so the patient should be in the lateral position. All these things should be, of course, instructed, but not in details. So the best way, yes, you can invite someone or you can tell your friends in order to educate them how they can deal if I have the seizure attack. As well as for the hypoglycemic sugar or hypoglycemic patient, the patient should be given sugar, right? So this disease or those two episodes, you should educate the patient that she can invite and she can tell her friends or family members how to deal with this condition if happen with me. Please give me sugar or candy in my mouth so I can regain my conscious level. This is one of the also safety netting at the end of the meeting. You can do it. I agree, but it's if you have time, you can do it, but not to jump or to skip the other task, like for example, pregnancy and the driving, for example. It's not important as the driving issue and the pregnancy issue. Okay. Good question. Thank you, Dr. Ghada, I think. From there. Dr. Azza, please be sure that your sound will be clear. We'll start the next scenario now. Are you ready, Dr. Asha? Before starting, anyone has doubt, question, suggestion? Okay. Here you go, Dr. Asha. Dr. Asha, you can start.
Yes. Hello. My name is Dr. Al Mahdi. I am doctor in medical ward today. Can I confirm I am talking to the Mrs. Ellie? Are you the daughter of the Mr. Lam?
Yes,
Mr. Ellie, we are here to discuss about your mother condition. That's okay with you?
yes, it's okay.
Okay. Do you want anyone attended to our meeting today?
No,
Okay. Assume are taking permission from your mother to discuss about her condition.
Yes, yes.
Okay. Are you next of kin?
Yes, ma'am.
Mhm.
Yes, doctor.
Yes. What do you know regarding your mother condition?
Well, doctor, I know my mother had an infection in her kidney, and she was admitted to the hospital and received medication. And they told us that she had a condition, something related to sac in her kidney, and this disease it may be inherited to us, our children. So I want to know, am I going to get this disease? Am I going to be sick eventually? That's what I'm worrying about. I'm worried about my mother, of course, but I'm worried about myself too. Am I going to get this disease too?
Your worry is acceptable, but before I address your concern, can ask you what do you expectation from our meeting today?
Like I said, doctor, I am worried. I want to know if I'm going to have this disease or no. If and if I could do any test just to make sure am I going to have this condition or not?
Well,
Yes.
yes. Well, Mrs. Ellie, your mother is admitted to the hospital because her condition is called acute pyelonephritis. Have you ever heard about that before?
Yes, briefly from the doctor.
Mm-hmm. Do you wanted me
Yes.
explain more about pyelonephritis?
No, it's okay. I get that she had this infection related to her kidney because of this condition that about these sacs around the kidney. It's
Yes, you
okay.
wanted. You wanted also me to explain more about the sac, the sac in her kidney regarding this disease, regarding her condition.
It just no, it's okay. I have an idea. Just I want, like I mentioned before, I would like to know if I am I going to have it or not, because I
Well,
did know it may run in family, so I would like to know, please.
your worry is understandable. Yes, the adult polycystic kidney disease is disease runs in family. That's meaning in the 50% of 50% on each one of the family can have the disease. As you mentioned, this disease is due to the sac fell into the kidney, leading to the symptoms such as recurrent infection, recurrent soreness, and also problem to the water work. And also, I'm sorry to tell you that disease may have some complication like affected into the kidney function and keep the kidney unfunctional well. Regarding your worry of the disease, yes, as I mentioned, this disease runs in family. You mean the 50% you have to get the disease. But we can do some imaging in your tummy, which they called ultrasound tummy, to know if you have the sac or not. Are you getting me?
Yes, I am getting you 50%. Oh my God. So am I going to get it? Okay, can you do this scan, what you said, ultrasound or what? Can you do it for me now?
This imaging, yes, imaging into your tummy. The imaging is used to confirm if you have the disease or not.
Okay, okay, I am willing to do it.
Yes, regarding the tummy, we can arrange it into the other. You can arrange it, the imaging with the other doctor to the other department to do the image. The image is used to screening and also used to confirm the disease if have the disease or not.
So, doctor, if I did this scan and it was okay, that means I'm not going to have this disease at all?
If what?
If I did this
If
scan, it was negative, so that means I'm not going to have the disease at all?
There is some criteria. Yes, if you do the scan and there's no cyst in your kidney, this the imaging is used for screening and confirm. There's some any other criteria may needed into the some test with the called genetic test, but there's regarding the some criteria. Not all the people to do if the scan is negative. Yes, you want to explain more about the genetic test?
Okay. Okay. I can do this. If the scan is not going to be conclusive, I think we can do this genetic test.
Yes, because you have the family history. You mean your mother have the disease, and also if the imaging is not meet, we can do the next step, the genetic test. Before that, I will refer to the genetic counseling to discuss with you about the test if needed or not. How does that sound for you?
Okay, that sounds good.
Mm-hmm.
Okay,
You have any other concern?
Yes, I do. I don't know. I am having planning to get pregnant, so that will be an issue.
Yes, this is good. Congratulations for planning for the pregnancy. But if you need to the plan for pregnancy, you need to keep you into the regular follow up by the kidney doctor and women doctor, because if you have the disease, may have some needed to the regular follow up to prevent you developing any complication during the pregnancy. And also regarding there's some tests, but there's no guarantee 100%, which they call the OVA selection. For that, I can refer to the genetic counseling to discuss with the test in detail.
Okay. Okay.
Because
Okay,
I
doctor.
mentioned that the disease runs in family. There are 50% your kids have the disease.
Okay.
Do you have any other concern?
No, doctor. I think we're going to do this test that you mentioned, and no, I have no other concern.
Okay, can I ask you some questions?
Yes.
Okay, what about your brother and sisters? What about
No,
health?
child, I don't have brother or sister.
2 minutes left.
Okay.
Sorry. I have one brother.
Mm-hmm.
One brother from my mother's side.
Can ask which age?
He's age of 17 years.
Age and 17. Okay. Your brother is also you needed to do the imaging into your tummy after the age 20 to screening if you have the same disease that your mother had or not.
Okay.
Do you smoke?
No.
What's your job?
I am a teacher.
Okay. Any other concern?
No. I have no
Okay.
other concern.
And also, I will give you some website to read more about adult polycystic kidney disease and read more about the disease, the Lagarde symptom and sign. And also, if you have any query, please do not hesitate to contact with us.
Okay. Okay. Thank you, doctor.
Mm-hmm.
Okay, still 30 seconds. You want to ask? You want to advise?
Yes. Advice is she is still not diagnosed as adult polycystic.
So, doctor, if I did have this disease and we did this tummy,
Yes, she still ask about the screening, how to know she has the disease or not.
If we did it and it found I have the disease, So what's going to happen to me?
Your worry is understandable. If the imaging confirmed that you have the disease, you needed to do some lifestyle modification, like avoid the vigorous exercise, because the vigorous exercise leading to the rupture of the cyst, and also do not take in any medication like antibug or any medication like painkiller before ask the kidney doctor, because this the medication can be affected into the kidney functional. And also, if you are planning to the pregnancy, you needed to inform the women doctor and kidney doctor. And also, you needed to control blood pressure if a blood pressure is high by some medication, and also needed to the prevented the infection into the kidney, and also drink a lot of the water, and also needed to the regular follow up, the urine analysis, and regular follow up the renal function test, to help you and prevented affected into the kidney functional.
Perfect. Really, mashallah, perfect, Dr. Rasha. You are ready to answer any concern related to this scenario. Okay, time is up. I added 1 minute for the last concern, which is important to raise, and the answer was perfect. Let's start the comment now. Dr. Azza, please.
Okay. I think, mashallah, Dr. Rasha, you did very well. I don't have much comment actually. Just I think you mentioned that we're going to do the scan with ultrasound. I think it's better to say we're going to do a tummy scan with a gel or so. I think ultrasound is a jargon. I'm not sure.
Yeah, you're right.
Yes.
Jelly scan.
Gel scan. I think
Yeah.
it's better to say better than ultrasound.
Mm-hmm.
I have a few comments about screening for genetic. Genetic is not usually used. I think there is a
Exactly.
few for genetic scan for patient suspected to have the polycystic kidney disease. It's what I remember that there is criteria that patient more than 30 and did a negative ultrasound unlikely to have polycystic kidney disease. Patient below 30, if it was negative, no indication to do another scan like a genetic or like MRI, unless there is a few, there is I think a few indication like if she's going to get pregnant, like planning for pregnancy, ultrasound was negative, she may be to be candidate to do a sophisticated image like MRI or like genetic test. Also, if she's going to be donate with her kidney,
Perfect. Yes.
I need to do a genetic test or an MRI if ultrasound was negative. But the most likely screening is through ultrasound.
Perfect.
Yes, but I think a genetic test, if the patient family history positive and patient going to the pregnancy and the ultrasound is negative, can do genetic test.
Yeah, this is the third situation. I will tell you in summary the three situation you have to do genetic testing after Dr. Azza finish comment.
Yes. You remember to ask about the siblings, and was important. Also, I mentioned that the brother was a teenager below age of 18, and it's a good point that you mentioned that after age of 18, you can do a scan for
20, 20, Dr. Azza, 20.
There is
20,
debate about
yes.
this.
Yeah, the
Found,
screening start after 20.
after 20, but I think it found somewhere that 18, but yes, after 20. And what else? Yes, that's it. I don't think you missed anything, mashallah.
Yeah, I agree with you. She covered the topic well and perfect. But in summary, I will tell you when to raise the issue of genetic testing or when to do genetic testing if the patient is concerning that. The three situations are, particularly in this scenario, her mother is autosomal dominant polycystic kidney disease, right? So her mother
Yes.
might end up with dialysis and end-stage renal disease. The daughter might think to donate her mother at any time. She will tell you, doctor, I want to do anything for my mom to be fine. Please give her my kidney. In this time, we will tell her we have to rule out the disease because at some age you might have the disease and you will be in failure earlier than expected. So the first situation, if the patient think to donate, okay? The second situation, if she's planning for pregnancy, as Dr. Rasha said, we will do the genetic testing in order to have safe baby, okay? Because if you have the disease as a genetic, sometimes the criteria is not fulfilled by the ultrasound, right? But if negative, we have to do the genetic testing again. So we will do the genetic testing in order to do ovagene selection, as Dr. Rasha mentioned, in order to have safe pregnancy and safe baby. The last situation, if the patient is going to be hired in sports or heavy job that in, it might be dependent on this job in the future, and if she has this disease later on, she might have, for example, injury or trauma to her tummy, and as explained by Dr. Asha, she might have rupture to the cyst, and she will be in trouble. These are the three situations. You have to do genetic testing after doing the screening. If the screening is negative and she's worried about, or you are worried about donation, you are worried about the babies, you are worried about her job and the harm might have from the job. Otherwise, in the old scenario, Dr. Rasha addressed the concern well, but don't forget, Dr. Rasha, always, as you said in the first scenario, you have to explain the complication. You didn't mention about end up with renal dialysis, right? You might end up with, if you have the disease, of course. I like when you tell me at the end, if she has the disease, I can advise that. Yes, you're right. But if she want to know more about the complication and the possible complication, you have to tell her that her mother, as she has the disease, she might end up with what's called end-stage renal disease, and she might have what's called dialysis. Dialysis is a machine connected to the body and through the blood to wash the blood from the toxin. And if you have the disease, most or not most of the patients, some of those patients might end up with what's called end-stage renal disease, and they might be dependent on dialysis, which is again the machine connected to the patient, and so on. These are the possible complications if you have the disease. Of course, we don't have now a guarantee that she had the disease, but she's worried about it. So you have to say, after confirming that the complication might happen is 1, 2, 3. Okay? That's why the last concern, if I have the disease, doctor, what could happen to me? Dr. Rasha also addressed it well in the last minute. So she told her, you have to control your blood pressure, you have to control the water intake, avoid vigorous exercise, avoid heavy sports, and do not donate your kidney. You have to mention that. And of course, try to plan your pregnancy. These are the safety netting you have to give at the end of the meeting if the patient expected to have the gene. Yes, there is possibility, 50%, as Dr. Rasha mentioned. Every person in the family can inherit the disease at a range of 50%. Good thing also, you invite her brothers, siblings, you have to screen for them. At the age of 20, they have to screen for that. And again, the genetic testing is not advisable unless there is particular situation which I mentioned earlier. Otherwise, no need to do genetic testing. The screening is enough. Let patient enjoy his life as long as he's not having the cyst or the criteria of the disease in his ultrasound or in her ultrasound. Okay? The genetic testing only needed at the three situations I mentioned earlier. The job you should address, the no need for driving here, the social support, you have to ask about with whom you're living, and to offer support for her mother. I think, Dr. Rasha, when you enter the scenario, you thought the scenario was about the mother. It's not about the mother at all. It was about the daughter. So no need to give her or to assume that you are talking about her mother. You are talking to the daughter because she's worried about her mother to be inherited to her, but it's not her mother condition. Okay, take care of this. But otherwise, you directed the scenario well after the introduction. So but I think also by the help of Dr. Azza, she told you, doctor, I don't want to hear anything about my mother. I don't want to hear anything about the
Yes.
pyelonephritis. She
Mhm.
targeted the point of her worries about the disease. So the doctor, please, and this is lucky situation. If you misdirected the scenario to the mother and the surrogate didn't correct you, you will be in trouble. But I think Dr. Azza helped you to correct the direction of the scenario to her, not to the mother. Okay?
Yes, yes, because the first confusion about talk
Yes,
about her or
exactly.
mother. Yes.
So take care, read your scenario many times. This is general advice. Read your scenario well. Write the most important thing you have to raise and focus on the task. What is the task down you have to do? Okay? I wrote here also the hobbies in my chat box just to remind myself. The hobbies. You have any hobbies? Sometimes some patients, they are not working as sports or doing any sports or heavy job, but sometimes she have, for example, she has hobbies to go to the gym, for example. You can ask about that. You have any hobbies? In order not to hurt yourself if you have this disease, please, after confirming that you are not having the disease, okay, continue your hobbies. But if you have the disease, you might have stop of these hobbies because it might hurt your kidney. Okay. Thank you, Dr. Rasha, Dr. Azza. A nice scenario and good performance from both of you. Dr. Azza also first time, as a first time, it's good, perfect. She did great. Any question, Dr. Rasha?
No,
Any
thank you.
comment?
شكراً جزيلاً.
Okay. Any comment, Dr. Azza?
Thank you.
Okay. We will open the discussion. Anyone has comment, please feel free to comment. I will try to read the comment in the chat box. Dr. Ilaf wrote, ultrasound after 20s has 99% sensitivity to detect autosomal dominant polycystic kidney disease. If no cyst in the ultrasound after age of 20, it almost can be excluded. I don't think, Dr. Ilaf, I am not sure also, I'm not a nephrologist, but I'm not sure because there is criteria.
After 30, it is 100%. After 30, not after 20.
Okay, but there is criteria. The patient might have cyst in his 50s and he might be diagnosed, right? That's why they put the criteria of diagnosis: cyst in both sides at the age of 59 or more than 60 years. This is what I remember. So the criteria depend on the age. So it's not only 20, right, Dr. Aisha? I'm not sure about 30 also, because there is criteria according to the age from less than
The 30
30.
is, yes, 100% negative predictive value.
You are sure about
But
this?
if in specific situation, like you said, Dr. Bassem, we can proceed for MRI or CT, more diagnosis. Yes, more
Okay,
accurate.
you mean the
But
technique
it is
itself?
for
Yeah,
negative
okay.
predictive value, it is 100%. Yes, I'm sure about that.
Okay. Okay, but still you can do the MRI to be more sure and more accurate. Okay. Dr. Ghada, I think GH means Ghada. This is what I guess. Doctor, one ultrasound scan after age of 20, if negative is enough and no need to be repeated later. No, I don't think so. It would be repeated because still it might be developed, the cyst, I mean. As Dr. Aisha mentioned, at the age of 30, if no cyst, it would be 100% no cysts. Okay, but don't go to this doubt. Don't say no at the 20 if you don't have. You will do the screening and follow up because this patient might have the disease at any age and the first screening was negative. You don't know, and you are not nephrologist. And this is also beyond the scope of PACES. They will not need you to explain more about the age expectation, when the patient will have a cyst or no. Just give the general features of the
Yes,
disease?
because she can ask you if I
Yes.
have, she is 26 in this scenario, I think, so she can
Yeah.
ask if I have no cyst in this ultrasound, it is, so I don't have, I will not have the disease. So you will say it is, yes, less this probability that you will have the disease, but still we will screen you
There
to
is.
the age of 30. But
Okay.
like you said, if a specific situation, we can proceed other
Yeah,
investigation.
you can do other investigation.
But you
Perfect.
can be assured here, no need for other investigation if it's negative, because it
Mhm.
is very, very high يعني sensitivity, this test.
Okay. Okay, thank you, Dr. Aisha. Dr. Karim, at the end of discussion, offer to give her information leaflet. Of course, this is for any scenario. If you have time to give leaflet brochure about the disease, the complication, the manifestation, of course you can give hospital contact number. Don't hesitate to call us. Of course, I agree with you, Dr. Karim. This is general law, not only this scenario. Any counseling about any disease, give leaflet brochures at the end of the meeting. Dr. Tasneem, is over selection is considered jargon? No. The sperm selection and over selection is general public words. It's not medical words. If she's not understanding what you are saying, you can tell her it's a procedure in which you can take the gene or the code, which should be healthy and not containing the disease. But I think it's clear over selection means some selection of the ova from the ovulation and the menstruation. I think most of the public knows about the menstruation and the ovulation and the ova selection. It's not in details, but at least generally. Yeah, Dr. S mentioned 3 age 30, of course. I wrote in reply, Dr. Ilaf, 30. Okay, 30. Yeah, you corrected, you mean. Okay, at the age of 30. Thank you, Dr. Ilaf. Any question about this scenario or previous scenario or communication scenarios in general? By the way, you can hear me? Hello?
Yes,
Yes.
yes, we
Yeah, okay. By the way, the scheme of any counseling, as Dr. Rasha and Dr. Azzas did today, I believe both the scenarios was about counseling about the disease, right? So the same, why this patient is having the disease, pathology, and the symptoms or manifestation, possible complication, and the management plan. It will not be out of these steps. The definition or the breaking bad news, if there is, for example, shocking news. But in the first scenario, I don't think it's breaking bad news. Epilepsy, something can be cured even after 2 years of medication. So it's not breaking bad news, just explain the disease. Even the next scenario, you cannot break bad news because you don't have the confirmation or you don't have proved data that this patient is having the disease. So you cannot do breaking bad news in both scenarios. Again, how to counsel about the disease? Simply after introduction, expectation, the finding, you can start by explaining the disease after mentioning the name of the disease. Don't explain without mention. So you have to say you have epilepsy. You have possibility of condition called the name of the disease. Then, have you ever heard about the disease? Yes or no? Yes. You can. You need me to explain. No, doctor. You need me to explain. Yes, doctor. Explain simply. Don't use more medical words. And you can tell her some manifestation. You might have tummy pain. You might have frequent infection in your water work. You might have any complication you want to mention. This is regarding the manifestation and complication. Always, always remember to give the most serious complication in any scenario or any condition. Why? Because this patient, possibly he will have this complication. And if you didn't explain to him this complication in this meeting, you will have another meeting with the patient and it would be medical error meeting. Why? He will tell you, doctor, your doctor or your colleague didn't explain to me about this complication. At that time, you will apologize. I'm sorry. This is not our habit. So please, always remember to give serious complication, even it is 1%. As in this scenario, possibility of end up with dialysis. Yes, there is possibility. but after confirming the disease, of course. But for her mother, there is possibility to end up with dialysis. Okay, so you have to explain the most serious complication at any step for any condition. Back to the counseling. The next step, complication mentioned already, the management plan. What are the possible management plan? We'll educate you about the patient, the plan of the management, either non-pharmacological or there is some medication. By the way, tolvaptan as a one of the pharmacological option in this scenario, don't raise it by yourself. Let her ask you, doctor, is there any possibility to medication or to have a medication to stop or to cure the condition? At that time, you can say there is new approved medication called tolvaptan. It help to not to increase the size of the cyst, but it will not cure the disease, as we know. Okay, but don't give her the option of the cure because it's not curable condition. Okay, next, the management plan, then the social. What's your job? With whom you're living? Who's dependent on you? Do you smoke? Do you drink alcohol? Do you drive if there is relation to the driving? Simply the counting of the disease in communication, I think it's much easy than other manifestation or other scenarios. Okay, if you have counsel about the disease, it's good scenario. You can get or you can gain a lot of marks. Any question or comment?
I want to ask about something not relevant to this scenario.
Again, please.
If patient came with chronic kidney disease and we explain the management plan, the hemodialysis, peritoneal dialysis, or transplant, and this patient is female and asked me about pregnancy. What will reply for her?
Sorry, I couldn't hear your question well. Can you repeat it, please?
Okay. If a scenario about chronic kidney disease,
Yes.
and we explain for the patient that the plan of management will be either hemodialysis, peritoneal dialysis, or
Yeah.
transplant.
Uh-huh.
And after that, she was female and asked me about pregnancy.
Mm-hmm.
How we reply for pregnancy?
You will reply for me. What do you think?
This with hemodialysis, with peritoneal and transplant cannot be pregnant. But with hemo, I don't know. I am not sure.
That's why you don't have the authority to give her the option, right? Unless written in the scenario you are the nephrologist. So even you are the junior or the senior and you have such complicated issues, the best way is to refer her, right? I will refer you to the woman doctor along with the kidney consultant. They will have a meeting with you to assess the possibility of your pregnancy simply and in diplomatic, safe way. By the way, the communication skill is not to test your information compared to how to manage and to play the game with the surrogate. Okay, how to answer him without giving wrong information. It's not the test or it's an exam for knowledge. If he knows how, is it possible to have pregnancy with intestinal disease on dialysis or peritoneal? Even it's not the nephrologist answer. There is possibility, maybe with the woman doctor with good follow up, but you will advise her is there is some hazards on your health, on your baby health. You don't know. So the best answer is to involve group of doctors. One of them is the woman doctor and the kidney doctor to address this issue and if there is any possibility to be pregnant safely. It's a matter of the safety of the patient. Okay?
Yes. Thank you very much.
Yeah, most welcome, doctor. Any other questions? Okay. Dr. Aisha, and draw better is explain disease and procedure. Of course, you can draw, and it's advisable to draw. If you have the talent to draw, you can draw. Even you don't have the talent to draw, just imagine and draw in simple way. Don't make a lot of complication and figures. No, it's simple way. Kidney, you can draw a kidney. and draw more circles inside the kidney. These are the cysts, or which is called sacs, and it might damage the kidney in simple way. So it's not wanted from you to draw good figure. Doctor cannot read any. Do summary again for autosomal dominant polycystic kidney disease scenario. Busy when you start talking. Okay. In summary, how to counsel about autosomal dominant polycystic kidney disease? Of course, you have to say first the pathology. Why this patient might have the disease? So the pathology here, or the cause, is inherited condition, right? Of course, after explaining or giving definition of the disease, the definition, it's a disease in which your kidney being filled with sacs. These sacs will be filled with fluid, and it might damage the kidney itself, and it will not give the chance for the kidney to work well. Okay, this is the definition. The pathology, it happened because of inherited condition, because you have the code from your mother, from your father, from your family in 50% range. The second manifestation of the disease, you might have a recurrent infection in your water work, you might have blood in your water work, you might have tummy pain or tummy distension, any of these. The complication, it might end up with dialysis, but this is the most serious complication. So you can talk about, for example, rupture cyst, you can talk about tummy pain, distension, but the most dangerous complication is end up with dialysis. I'm talking about polycystic kidney disease as confirmed diagnosis, but in this scenario, it's not yet confirmed. So you are talking about the possibility and how to confirm the screening. Okay, this is different scenario, but I'm talking about polycystic as a confirmed. If not confirmed, so you can talk about the screening program, when to start screening, and the possible other option to do screening, which is genetic testing. What are the situation to do the genetic testing, and so on. But I'm talking about confirmed one. The management plan, how to manage this patient, as Dr. Rasha said at the last minute, drink plenty of water, please control your blood pressure, take care of your diet, follow with our dietitian program, and so on. There is pharmacological option. Yes, there is one medication called tolvaptan. It might help to regress or not to increase the size of the cyst. If you have end-stage renal disease, you might have solution which is called dialysis, in which your blood body connected through channels to a machine to wash the toxins from your blood. Then the social support, the job, and screening if you are planning to screen for the family member. Okay, this is a third scenario. So today we discuss possibility of autosomal dominant polycystic and the screening. The first scenario was about the epilepsy, and the last I mentioned was about confirmed autosomal dominant, how to explain the manifestation, the complication, and the pathology. Okay, clear now? Anyway, any missed point, don't worry, it will be in the meeting, in the recording, so you can hear it again in details. Okay. Any question before ending the session? Any doubt, any suggestion? Okay. So the time to thank everyone, particularly Dr. Rasha and Dr. Azza, who's also shared the comments verbally or written. Thank you everyone for the attendance.
Thank
See you
you.
tomorrow.
Thank you.
Thank you. See you tomorrow, inshallah, with the short clinical station. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Dr. Bassel.
Thank you.